Good evening, everybody. This is Dr. Richard Lehman in your corner with CORA, and today's date is 6/24/2020. We're just coming out of the pandemic, or we hope we're coming out of the pandemic. And tonight we have a very interesting topic, which is golf injuries. And hopefully, as everybody starts getting back to normal activities and normal sports in the middle of the summer, we would hope that a lot of people are going to be getting back to golf. So golf injuries are very, very pertinent. And we have a very, very distinguished group tonight. So I'm going to introduce them, a number of people with TPI certification, and they're going to explain that as our first question. But first, let's just jump in and let's introduce our guests. So starting with Lane.
Hi, I'm Lane Pereira. I'm a physical therapist here in Sawgrass, Florida. You guys probably know that from TPC Sawgrass. We're right across the street from the facility down there where the Players Championships played. I'm a board certified orthopedic specialist in physical therapy. And as you can understand from our location, we see a lot of golfers, recreational and other, in the clinic.
Tommy.
Callahan. I'm a physical therapist assistant. I work in Sawgrass clinic there at the country club as well, Lane. As you know, in Ponte Vedra, we see a lot of golfers. Right now I am TPI certified in fitness level 2. And I also instruct a golf fitness and mechanics class there at Sawgrass Country Club.
Thank you very much. Craig?
My name is Craig Broadbent. I'm a physical therapist and clinic manager in Knoxville, Tennessee, part of the Tennessee Orthopedic Clinics, part of the CORA system. Got a little history in golf as far as I went to school at UT and then graduated with a sports management degree, worked for the PGA of America, operations, a little background on that, and then decided to go into physical therapy and pursue that and really pursue the passion of just treating golfers and, people of all walks of life, but I really have a passion for treating golfers as well. So I'm TPI certified in the medical level 1 part of it.
That's awesome. Working for the PGA must have been a treat.
Yeah, it was fun. It was fun. It was long hours but not much golf. That's the only downside. So,
Dr. Collier, you're up, buddy.
Yeah, my name is Chris Collier. I am a chiropractor in St. Louis, Missouri. I'm in private practice. I own a clinic called Elite Chiropractic and Performance. I am TPI level 3 medical certified and level 2 fitness certified. I incorporate a lot of different, sports medicine, sports rehab type protocols in the practice, as well as general strength and conditioning. I'm a strength and conditioning specialist as well, so it's kind of a good blend. And golfers are my favorite. They're usually the ones that are willing to get better, and they'll do what we ask them to do, which is not always the case with other patient populations.
All right, so to start out, everybody's talking about this TPI certification, and for our listeners out there, basically that means Titleist Performance Institute. And Craig, why don't you give us a little heads up and explain exactly what it means to be TPI certified and what some of the different certifications are.
Right. So TPI, like you said, Titleist Performance Institute, they really try to blend many areas. So there's a medical, there's a fitness, there's one focused on junior golf, and y'all can fill in if I'm forgetting one or two. But basically, it blends, the way people move and the way people interact, in daily walks of life are going to affect, honestly, how they swing the golf club. So everybody's going to move differently, and some people everybody swings the club differently. But how you move is going to affect how you swing. Some people have limitations, and the TPI system can kind of break down those limitations. And everybody's going to have some. Not even the PGA Tour golfers have no limitations. But the problems that we see in amateur golfers is those limitations can lead to compensations over time, and which compensations can lead to injury over time. So that's really where the TPI system has a full system that can screen and break down your limitations and compensations.
Thank you. That was pretty good. So we're going to basically jump in here a little bit, and we're going to talk about one of the more important things. I'm an orthopedic surgeon, so I don't really have the same in-depth knowledge of golf biomechanics as somebody who's obviously teaching golf, a golf instructor, etc. But we see a lot of golfers, and we see a lot of high-level golfers, PGA golfers, and local professional golfers. So one of the things that I think everybody talks about, and we're going to talk a little bit about later as well, is club head speed. And what I really want to know to start out with is, how does club head speed affect your upper extremity? So Lane, we're going to start with you as a leadoff hitter, and tell me about club head speed, stress on the upper extremity.
Yeah, golf is one of those activities, like all of our other rotational sports, baseball, tennis come to mind as well, where we're really creating a lot of rotation and torque through the body, ground reaction forces, and the upper extremity is really kind of the culmination of all that stress coming up from the ground, through the shoulder, through the elbow, and finally through the wrist and the club. So as you can imagine, like Craig was already talking about, that we can create a lot of compensation, and if we're missing movement in certain areas, or we're not moving correctly in certain areas, it can create a lot of stresses through the body. There's normal stresses that happen even in a normal swing. We can create problems at the shoulder. The rotator cuff is one of those areas, because we're bringing the shoulder up into an externally rotated position at the back of the swing, and then down through the follow through, we're quickly bringing it into an internally rotated position. So just like a baseball pitch or a tennis swing, we're creating stress on the back of the rotator cuff. And that we also, of course, everybody knows what golfer's elbow is. We've all heard of that. That's medial elbow pain. That's really a common injury that happens with gripping and flexing the wrist. So a lot of people get that as a repetitive stress injury as they're pronating the hand through the swing. And then, of course, probably the most common injury that you're going to see in higher level golfers, professionals, and our lower handicap golfers is the wrist injury, right? And that's because they're trying to create a lot of spin on the ball. They're really hitting down through the ball into the swing, and they're creating a lot of impact force when they're hitting the ball there.
Thank you. So let's take that a little bit further, Tommy. When we're talking about stresses of the wrist, let's talk about a couple of different things. Let's talk about different stresses when you hit a wood versus you hit an iron, and also where you think the stress is dissipated most, hitting a golf ball correctly and hitting a golf ball incorrectly. Kind of a lot to ask, but I'm going to go.
So whenever we talk about stressors to the wrist, leading off with maybe your iron clubs, you're obviously, especially like Lane had mentioned, the higher level players are going to be striking down on the ball, and those higher level players get a little wristy because they want to put a little more control on the ball, whether they're trying to fade it or draw it. And when that happens, they're actually striking the ground after the ball, and a lot of that impact will be felt through the wrist and through the wrist extensors, especially on that lead hand. So if you're a right-handed golfer and you're striking down with that lead hand being your left hand, a lot of those stressors are going through your extensor muscle groups and tendons connecting into the wrist and hand there, being impact force, depending on the angle that they hit, if they're a little off, and if they take a little bigger chunk, and depending on the ground force, they can really strain a lot of those extensor tendons and muscles through there in the wrist. So with the woods, you're probably not taking as much of a divot. Hitting a clean ball obviously isn't going to add as much of that impact force on the back of the wrist there, and then a lot of the rotational force following through the swing, as long as there's good control, will keep a healthy wrist for you.
So is there more stress on your wrist when you hit an iron or when you hit a wood?
I would say an iron, just because of the goal of the swing is to strike down on a ball. And if you watch on TV, a lot of times you'll see those big fat divots, those beaver pelts that they throw out there, and it's basically chopping wood. You're putting a lot of force in that downward angle and then trying to carry and follow through. And if you hit it a little fatter than intentional, or if your wrist is at a little more supinated position and you're closed off a little bit too much, it's going to add that real big extensor force to those tendons. So it can get a little bit more impact through those iron clubs than the woods.
Thank you. So Dr. Collier, specifically anatomically, what kind of wrist injuries do you see in golfers? Do you see TFCC injuries, ECU injuries? What kind of explain to us, maybe a little bit more medical, about the anatomical breakdown and what happens to a not so good golfer, I don't want to say a crummy golfer, but an amateur golfer and somebody who's a little bit more proficient?
Yeah, so you mentioned TFCC. That's kind of one of the killer injuries with golfers, and the things that may not be fixed with the traditional rehab and manual therapy. And we kind of see that those may be surgical cases kind of quickly, but that's where the TFCC, the triangular fibrocartilaginous joint. I mean, it's a mouthful. That's why we call it TFCC, right? But inner side of the wrist, and if you're a right-handed golfer, you're going to see that a little bit more within the bottom hand. And I think we might find it when people don't rotate well, pronate, supinate, so they overly ulnar deviate their wrists, so they're kind of flexing it down too much. That would be more of the anatomical things that we'll see. Occasionally we can get some just more extensor tendonitis of the wrist, maybe in the more of the trail hand, because we're either weak in the extensor muscles, or one thing you always got to look at is training mechanisms and what are we hitting off of. And I think one of the most common cause of any wrist injury in golf is we're hitting off of surfaces that are too hard, or our ball contact's not so good, so we're hitting things fat, and that force kind of works its way up the club, and the wrists are the first things attached to the club. So but definitely TFCC injuries are probably the biggest things, and maybe some de Quervain's syndrome, where we get some tendonitis or tenosynovitis of the thumb. A lot of similar mechanisms. I think if we're overloading one part of the wrist versus the other, or we're not getting our lower body into the swing, that can start to stress the wrist a little bit.
Thank you. So quick question. Do you see many extensor carpi ulnaris, ligamentous or extensor carpi ulnaris, hang on, kind of the inferior sling. So the basically the connection of the ECU to the fifth metacarpal. So let me take it from the top. Do you see very many ECU ligamentous injuries or tendinous insertion injuries where the ECU basically becomes destabilized from the repetition of hitting a golf ball? Dr. Collier.
Yeah, I'd say that's definitely a possibility. It's always tough, if you come to like my clinic where I don't have the imaging to really tell you what's going on, I just know the location. But whenever we have a wrist injury or issue per se, typically something in the forearm is contributing, whether it's extensor or flexor muscles, and therefore, the elbow might be involved by extension. So I would say, yeah, that would be a definite correlation there too.
So Craig, tell us how you're going to treat these injuries. Somebody comes in, they've got a TFCC injury, or they have a little bit of instability of their ECU, or a ligamentous insertion, degenerative breakdown. What would be the first line of treatment? And give me a time frame of how long you think it would take to get somebody back playing at a reasonable level after this type of wrist injury, if you were to treat it conservatively.
Right. So, I mean, the first thing I would look at is where's the source of pain, kind of like Chris commented on. It's a lot of times it's forearm, above or below a joint. So I'm going to check Range of motion, strength, movement patterns, all that stuff, make sure they're moving correctly as far as at the wrist, the elbow, even the shoulder. That's find out what's limited. One of my go-tos and treatments is, find out what's stiff, find out what's weak and treat that. And then you're usually going to have some success with that. So you want to have really good radial deviation. So when you take it back to the swing, you can kind of cock your wrist. And you want to be able to maintain that radial deviation coming through as you make impact. Same thing with just releasing and pronating through the swing. So that's kind of what I would check. Structural things. I would check movement patterns, see how that person's moving throughout the swing. And then I would, use my screening and check and see how they're cocking their wrist, rotating their wrist, and treating that way. And, soft tissue mobilizations, joint mobs, all that stuff that we can do in the clinic on the medical side of it that can really just improve, once again, strength, range of motion, all those things to get through the swing. You also want to look at their how much they're really using it. Like, are they beating balls? Are they beating 100 balls every other day? And that's a huge part of it. Are they just playing? I mean, if they're good range racks, they're going to be putting a lot of stress, a lot of repetitive stress through that wrist, through that forearm, and maybe you can kind of talk to them about modification through that. Or you can maybe encourage them just to go play, and that's a little less stress because you have gaps in between when you're hitting golf balls, and you're hitting different clubs as well instead of hitting the same club over and over and over. And as far as a recovery time, it's hard to say, but that's another part of it too, is just, gradually get them back to playing. Don't just let them go full bore if it's a repetitive traumatic or back injury even too. You want to let them modify into this, make sure that they're meeting their goals, and just kind of gradually go into that as far as a return to rehab or return to play after rehab.
Thank you. One of the things that's helped me over the years is I'll have the golfers go out and hit 4 or 5 different clubs. I'll videotape from the side, videotape from the back, and then anteriorly, and then just kind of do a little slow motion looking at rotation, just like you're talking about, pronation of the wrist, radial deviation of the wrist. And I think you really learn a lot from that in terms of exactly what's happening when they're hitting the ball and when they're hitting the ball with different clubs. So I think there's a lot more to it than just saying, we're going to ice and stim you and see what happens. I think the mechanics of golf, you guys are almost like golf instructors in a way to try to change the biomechanics of joint stresses when you're hitting the ball. Everybody, thank you very much. This was excellent. The content was excellent. You guys were just phenomenal. So everybody have a good night. Have a great weekend. Saying goodbye from CORA in your corner. Take care.